Pica. Persistent eating of non-nutritive, non-food substances like paper, soap, cloth, hair, string, wool, soil, chalk, talcum powder, paint, gum, metal, pebbles, charcoal, or coal, ash, clay, starch, or ice. This behavior is also inappropriate to the developmental level of the individual. For example, a baby teething on a plastic toy would not be considered indicative of pica. It must also not be part of a culturally supported or socially normative practice. Rumination disorder. Repeated regurgitation of food over a period of at least 1 month. Regurgitated food may be rechewed, re-swallowed, or spit out. Previously swallowed food that may be partially digested is brought up into the mouth without apparent nausea, involuntary retching, or disgust. The food may then be rechewed and then ejected from the mouth or re-swallowed. Regurgitation is frequent, occurs at least several times per week, typically daily, and is not attributable to any other gastrointestinal or other medical condition. Avoidant-Restrictive Food Intake Disorder, ARFID. A feeding disturbance as manifested by an apparent lack of interest in eating or food, avoidance based on the sensory characteristics of food, or concern about aversive consequences of eating. This manifests by persistent failure to meet appropriate nutritional and/or energy needs associated with one or more of the following: significant weight loss, or, in children, failure to achieve expected weight gain or faltering growth, significant nutritional deficiency, dependence on enteral feeding, such as an NG tube, or oral nutritional supplements, marked interference with psychosocial functioning. This disturbance is not better explained by a lack of available food or by an associated culturally sanctioned practice. Anorexia nervosa. Restriction of energy intake relative to requirements, leading to a significantly low body weight. Significantly low weight is defined as a weight that is less than minimally normal, or, for children and adolescents, less than that minimally expected. An intense fear of gaining weight or of becoming fat, or persistent behavior that interferes with weight gain, even though at a significantly low weight. Individuals with anorexia nervosa tend to have a disturbance in their self-perception, or a persistent lack of recognition of the seriousness of the current low body weight, also commonly referred to as body dysmorphia, and their body weight or shape has an undue influence on their self-evaluation, so it's likely that they would believe that their body weight or shape has a large impact on themselves as people. Orthorexia nervosa. Although not officially in the DSM-5, orthorexia nervosa is characterized by an obsessive focus on healthy eating as defined by a dietary theory or set of beliefs whose specific details may vary, marked by an exaggerated emotional distress in relationship to food choices perceived as unhealthy. Weight loss may ensue as a result of dietary choices, but this is not the primary goal. Compulsive behavior and/or mental preoccupation regarding affirmative and restrictive dietary practices believed by the individual to promote optimum health. Violation of these self-imposed dietary rules causes exaggerated fear of disease, sense of personal impurity and/or negative physical sensations, accompanied by anxiety and shame. It's important to consider that even though dietary restrictions can escalate over time, even leading to elimination of entire food groups and progressively more frequent and/or severe cleanses, also known as partial fasts, the desire to lose weight is absent, hidden, or subordinated to ideation about healthy eating. As summarized by Bratman, people are ashamed of their anorexia, but they actively evangelize their orthorexia. People with anorexia skip meals. People with orthorexia do not, unless they are fasting. Those with anorexia focus only on avoiding foods, while those with orthorexia both avoid foods they think are bad and embrace foods they think are super healthy. Bulimia Nervosa. Recurrent episodes of binge eating, followed by recurrent inappropriate compensatory behaviors in order to prevent weight gain. An episode of binge eating is characterized by both of the following. 1. Eating in a short period of time, for example within any 2-hour period, an amount of food that is definitely larger than what most individuals would eat in a similar period of time under similar circumstances. And 2, a sense of lack of self-control over eating during the episode. For example, a feeling that one cannot stop eating or control what or how much one is eating. These recurrent inappropriate compensatory behaviors, commonly referred to as purging, can include self-induced vomiting, misuse of laxatives, diuretics or other medications, fasting, or excessive exercise. Similar to individuals struggling with anorexia, bulimic individuals' self-evaluation is also unduly influenced by their body shape and weight. Binge eating disorder. Recurrent episodes of binge eating, on average, at least once a week for 3 months. To recap, an episode of binge eating is characterized by both of the following. 1. eating in a short period of time, for example within any 2-hour period, an amount of food that is definitely larger than what most individuals would eat in a similar period of time under similar circumstances. And 2, a sense of lack of self-control over eating during the episode. For example, a feeling that one cannot stop eating or control what or how much one is eating. The binge eating episodes are associated with 3 or more of the following: eating much more rapidly than normal, eating until feeling uncomfortably full, eating large amounts of food when not feeling physically hungry, eating alone because of feeling embarrassed by how much one is eating, feeling disgusted with oneself, depressed, or very guilty afterward. To be classified as BED, the binge eating must not be associated with the recurrent use of inappropriate compensatory behavior as in bulimia nervosa, and does not occur exclusively during the course of bulimia nervosa or anorexia nervosa. OSFED, other specified feeding or eating disorders. Previously known as EDNOS, eating disorder not otherwise specified, OSFED, other specified feeding and eating disorders, is a term for individuals who definitely experience disordered eating or feeding despite not fitting the criteria for any of the previous eating disorders. These other specified feeding and eating disorders include atypical anorexia nervosa, where all the criteria for anorexia nervosa are met except that despite significant weight loss, the individual's weight is within or above the normal range. Bulimia nervosa of low frequency and or limited duration, where all of the criteria for bulimia nervosa are met except that the binge eating and inappropriate compensatory behaviors occur, on average, less than once a week and or for less than 3 months. Binge eating disorder of low frequency and or limited duration. All of the criteria for binge eating disorder are met, except that the binge eating occurs, on average, less than once a week and or for less than 3 months. Purging disorder. Recurrent purging behavior to influence weight or shape, for example self-induced vomiting, misuse of laxatives, diuretics, or other medications, in the absence of binge eating. Night eating syndrome. Recurrent episodes of night eating as manifested by eating after awakening from sleep or by excessive food consumption after the evening meal. There is awareness and recall of the eating. The night eating is not better explained by external influences such as changes in the individual's sleep-wake cycle or by local social norms. The night eating causes significant distress and or impairment in functioning. The disordered pattern of eating is not better explained by binge eating disorder or another mental disorder, including substance use, and is not attributable to another mental disorder or to an effect of medication. It is important to treat feeding and eating disorders with the seriousness and care that they require, and if you recognize some of these symptoms in yourself or a loved one, I strongly encourage you to reach out for help from therapists and or medical professionals. Thank you for clicking and watching through this whole video. Please leave any comments about how I can improve these videos for you in the future, or feel free to share your own experiences down below. I'll be reading all of the comments. Have a great rest of your day.